Time now is 8:14. I'm Dan Edwards, and joining us from Dayton Children's Hospital is Dr. Greg Ramey. Thank you, sir, for joining us.
Morning, Dan.
Appreciate you being with us. And we want to discuss the prevalence of attention deficit hyperactivity disorder, or ADHD.
Correct.
And I want to ask first, doctor, what exactly is ADHD?
It's primarily a childhood disorder marked by symptoms either in problems with attention, impulsivity, or activity. Those are the three main things you look for.
Is it more common in boys or girls or both?
It's about twice as common in boys than it is girls for reasons that we can only speculate about, but boys typically are diagnosed about twice as often.
And what are the symptoms that we're looking for with the children?
Typically, children have a hard time paying attention. They tend to be impulsive. They tend to be very active. And this just isn't response to a particular situation, but it's kind of chronic and across the board. And it's something that lasts not just for a couple days, but something that typically occurs over weeks, months, and even years.
But most kids are kind of hyperactive and really energetic. I mean, how do you know? I mean, when there's a real problem.
That's the real issue, is that we are concerned that a real diagnosis may be overdiagnosed or inappropriately diagnosed in some situations, leading to the wrong treatment. And that's why we're concerned about some of the high rates that are being reported right now of ADHD.
And in some of your readings, you cite that some of the southern states have higher issues of this. Why is that, depending on where you live?
Well, it's troublesome that if you live in Arkansas and South Carolina, the likelihood of being diagnosed with this disorder is twice as high than if you lived in Colorado. It's raising some of us to question whether or not there's misdiagnosis going on here. And given the fact that many kids who are diagnosed are put on medication, which is a $9 billion industry, it's making us wonder whether or not there's an inappropriate diagnosis and a treatment of medication rather than other alternative treatments that can be just as effective.
If you have concerns, what should we be doing?
Talk to your family pediatrician, consult with an expert psychologist. That's the best way to get the correct diagnosis and the best treatment.
Yeah, so get a comprehensive evaluation, a variety of treatment options for you, and as you mentioned, avoid medication if possible.
Medication works very well in some situations, but don't rush to medication as the first choice of treatment.
All right, Dr. Ramey, thank you for joining us this morning and
Thank you,
sharing
Dan.
this. Appreciate it. All right, our time now 8:17, and just ahead on 2.